Hi everyone, welcome to Earthbound Health. Please subscribe and come back often to get more no frills, no nonsense valuable health information. Did you know that some of the most commonly prescribed drugs could be silently damaging your kidneys? In this video, we'll uncover the hidden dangers of these drugs and how they could be putting your health at serious risk. Stay tuned to learn how to protect your kidneys before it's too late. Every drug you put into your body passes through your kidneys. If the drug is not taken following your healthcare provider's instructions, or if it is an illegal substance, it can cause injury to the kidneys. Your kidneys are part of a well-designed filtering system in your body. They remove toxins, waste, and extra fluids from your blood through urine. But if your kidneys get injured or damaged, they can't filter out waste like they're supposed to. Certain health conditions such as diabetes and high blood pressure and several medications can cause this type of damage. Medications that are harmful to the kidneys are called nephrotoxic medications. Some of these medications only slightly worsen kidney function, while others could cause more serious injury. Your risk for kidney damage depends on your individual health conditions and the medication you're taking. Here are the top 10 drugs that have been linked to kidney damage, but this doesn't include everything. So talk to your healthcare professional about your full medication list. They can tell you how each medicine might affect your kidney health. The first one is NSAIDs. Non-steroidal anti-inflammatory drugs, NSAIDs, are popular remedies for pain and fever, and they're widely used to treat a host of health conditions such as rheumatoid arthritis, menstrual pain, and inflammation. Some NSAIDs are ibuprofen, Advil, Motrin, and Aleve. NSAIDs, such as ibuprofen, are generally well tolerated, but taking them does pose some risk. These medications can reduce blood flow through the kidneys, which can contribute to kidney damage or failure. People with heart failure, liver disease, or existing kidney problems are at a higher risk for experiencing new or worsening kidney problems from NSAIDs. In general, it's best to take NSAIDs sparingly at their lowest effective dose and for the shortest period of time possible. Occasional doses of NSAIDs taken in recommended amounts are much less likely to cause kidney damage. And then you have diuretics. Diuretics are water pills, treat health conditions such as high blood pressure and heart failure. Popular diuretics include hydrochlorothiazide, Lasix, and aldactone. These diuretics are usually well tolerated, but as with all medications, they can cause side effects. One potential diuretic side effect is acute kidney injury, especially in older adults. This is likely because diuretics lower blood volume, which disrupts the filtration process. But diuretics, especially in recommended doses, are not always bad for your kidneys. Kidney damage is more likely with higher doses of diuretics. Then you have ACE inhibitors, angiotensin converting enzymes, ACE inhibitors. They can be good and bad for your kidneys. You can easily identify these medications because they end in pril, such as lisinopril and ramipril. ACE inhibitors are go-to medications for managing high blood pressure and heart failure. And in these conditions, they can protect the kidneys. But ACE inhibitors are cleared out of the body through the kidneys, so they can also carry a risk of causing kidney injury. You're more likely to experience kidney problems related to an ACE inhibitor if you're dehydrated or taking other nephrotoxic drugs. In either case, you should start on a lower dose. Your healthcare professional may also recommend that you come in for routine blood tests to monitor your kidney health over time. Other kidney damaging drugs are iodinated radiocontrast. Iodinated radiocontrast refers to the contrast dyes used during radiographic testing, such as a CT scan. The dyes make it easier to detect any abnormalities in your organs and blood vessels during the scan. But the downside is that iodinated radiocontrast agents can lead to kidney injury. This type of kidney injury usually appears within 24 to 48 hours of receiving the contrast, and the risk factors include having existing chronic kidney disease, having low blood volume, or taking other nephrotoxic drugs. You also have the drug vancomycin. Vancomycin is an antibiotic used to treat infections caused by specific bacteria like MRSA. It's frequently used in the hospital when someone has a serious infection. Kidney damage from vancomycin usually happens within 17 days of beginning treatment with the medication, and kidney function usually improves after treatment is stopped. You have amyoglycoside antibiotics. When given as an IV infusion, these antibiotics are known for causing kidney injury. People with chronic kidney disease, who are dehydrated, or who have been taking these antibiotics for longer than 10 days, are at higher risk for kidney injury. Common IV amyoglycoside antibiotics include gentamicin and streptomycin. These medications are typically only used in hospital settings, so treatment can be closely monitored. HIV medications like Truvada can cause kidney damage. Certain HIV medications have been linked to kidney damage. Truvada and other HIV meds can cause acute kidney injury in certain situations. It's important that anyone planning to take these medications should first be screened for kidney problems. People with existing kidney problems may need to take a lower dosage to be safe. Antiviral medications, such as Zorvarix, can also cause kidney injury. These medications can produce crystals that don't dissolve in urine. These crystals can cause blockages in the kidney's filtration system. This side effect is more likely to affect people who are dehydrated or have existing kidney disease. You also have zoledronic acid. Zoledronic acid, also called Reclast, belongs to a group of medications called bisphosphonates. These are used to treat osteoporosis. Kidney damage is a rare but serious side effect associated with zoledronic acid, and the FDA issued a formal warning regarding the risk. In general, Reclast should be given to people with abnormal kidney function or pre-existing kidney damage. Calcineurin inhibitors. These are immunosuppressants commonly prescribed to people who have had an organ transplant. These medications have the potential to cause kidney damage. The benefits of these life-saving medications often outweigh the potential risk of kidney damage, but it's still good to keep this in mind. Some people don't realize that excessive alcohol can damage the kidneys. In general, over-the-counter laxatives are safe for most people. However, some prescription laxatives that are used for cleaning the bowel, usually before a colonoscopy, can be harmful to the kidneys. Most street drugs, including heroin, cocaine, and ecstasy, can cause high blood pressure, stroke, heart failure, and even death. In some cases, from only one use. Cocaine, heroin, and amphetamines also can cause kidney damage. Many people aren't aware that certain herbal supplements can also damage the kidneys. Here is a partial list of herbs that people with kidney disease should avoid, according to the National Kidney Foundation. Astragalus, horsetail, licorice root, parsley root, barberry, nettle, goldenrod, and java tea. When should you see a healthcare professional about suspected kidney problems from your medication? It's not always easy to tell if you have kidney damage. You might not experience any symptoms, and your healthcare professional may only notice signs of it after running certain lab tests. However, if you notice any of these symptoms, be sure to talk to your healthcare professional right away. Blood or foam in the urine, dark colored urine, a noticeable change in urinary frequency, lower back or flank pain, decrease or difficulty urinating. If you have any of these side effects, your healthcare professional will probably order lab tests to evaluate your kidney health. Based on the results and what medications you're taking, you may need to stop or pause treatment. In some cases, you may be able to switch to a medication that is safer for your kidneys. Maintaining kidney health is crucial. Following these guidelines can help keep your kidneys healthy and functioning properly. Thanks for watching. Please subscribe and come back often to get more valuable health information. Until next time, be safe, be well, and be prosperous.